we are going to be talking about Little Patients, Big Impact, a pediatrician's perspective on modern child health. And before we jump into the session, I would love for you to share a little more background on your practice and your training and the work that you're doing at Children's National Hospital.
Hi, thanks for having me. So I am a general pediatrician by training. A few years ago, I started getting into clinical informatics and working with electronic medical records to make sure they work with our workflows and more efficient, working on design phase for implementation and trying to make sure that the tools we use are effective. I work at a community-based practice through that is connected with the hospital. So I have a lot of interest in addressing preventative care because we work with children, and that's a great opportunity. And trying to figure out tools that help us in the digital health world to make an impact on children as best as possible.
Wonderful. Well, thank you for all the work that you're doing. It is so important. And, a big part of what you do is obviously communication. And we know in healthcare in general, the doctor-patient relationship there can be a communication challenge there, as well as trust that needs to be a key part of that. And it's hard enough to do that with adults. But from your perspective, how do you approach those the right way to communicate and build that trust with younger patients as well as their caregiving adult parents?
Yeah. So I think it actually begins with the parents. The goal in pediatrics is to stay with the child through their life and build continuity. So when they're babies, obviously they're not really communicating. So you're building that foundation first with the caregivers, and that also goes to building trust with the kids. Once they grow up and they see that their parents trust you, they're more likely to do so themselves. And then trying to connect with them on an individual level, especially adolescents. We're always trained in pediatrics and medicine in general to ask open-ended questions so that you hear that voice from the patient, and taking that and making sure you are hearing them and listening to them and letting that inform the care you're giving. And we also use something called motivational interviewing when you are talking about behavior change, which is a whole lot of pediatrics when we deal with behavioral health. You need to assess what stage they're at in terms of making a change. If you know they need to stop playing video games 24 hours a day and eat better, but they are not at the stage where they are at all going to listen to you, if you just lecture them on the benefits, they're not going to listen. They're not going to communicate with you. They're not going to respond. So you really have to assess where the patient is, and use that in your future conversations.
Makes sense. And it's interesting that we had an earlier session with Sally Frank, who was with Microsoft and works with startups. And a theme I'm hearing pulled through, even in the clinical side, is the need to listen, and really listen to understand what are the true underlying problems here, and make sure that you are able to really understand and analyze and get the right solutions for them. And you mentioned earlier too, you're very interested and excited about the preventive care space, and hopefully dealing with younger patients, you might have an opportunity to intervene earlier. What are the biggest challenges that you face as a pediatrician when it comes to preventive care and those early interventions?
Yeah. I think it's two things. One is on actually the financial model side. Like, I went to a conference and they were actually talking about how, like, our current insurance model is not geared toward preventive care. It is geared towards the sick person model, and which is the vast majority not what we're dealing with in kids. So the things that we need in order to address, physical activity, all this like cardiovascular risk factors for later in life, we don't have many of those tools, and our visits aren't designed to address those, and it's hard to get reimbursement for those kind of things. So if anybody has any ideas on how to revamp the healthcare financing model, more power to you. I think the other thing is with families themselves, because healthcare is seen as that sick model, they need to see the value proposition in trying to prevent health. That means following up and coming to visits regularly. There's a guideline from the American Academy of Pediatrics that in order to address obesity, you need 26 hours with a patient face to face in a year or 6 months. That is a lot of visits, and it can't be all in the pediatric space. One, nobody's going to pay for it. Two, nobody has the time to come to the visits. And then when you're just thinking about the whole family dynamics, making a visit once, twice a year is hard for families. So needing to be in spaces where the family are so we can meet them where they are. Otherwise, there's just not enough time in the day.
Agree. And, that's, I think, an opportunity when we think about digital health.
Yep.
To leverage the technologies to be there where they are in a more effective, efficient way. So could you talk a little bit about any, obviously HITLAB are very focused on digital health. I mean, are there any new tools or technologies or treatments or research developments in the innovation space in the pediatric area that you're particularly excited about?
Yeah, I think a lot of the precision medicine kind of innovation is very interesting, and especially a lot of the predictive models that people are working on. When you're thinking about prevention, you're thinking about risk factors. So predictive models that can identify the things that you can focus on are useful tools. I think integrating that more for the individual providers to use and connect that with the patients is where a big gap is, especially in pediatrics. Wearable devices and all that kind of thing are often more on the consumer side, and especially, at least I work a lot with, and children, and the vast majority of children in this country are actually on low-income insurances. So when you're talking about consumable products, it's a little bit more difficult to make that connection. So I think there is an opportunity, but that digital divide is part of the thing that needs to be addressed in order to make it available.
Agree. And I feel like in some of our discussion here, you've shared some real pain points and opportunities that when it comes to the coverage or the ability to get access. Again, these are areas where I do believe that digital technology data can really help bridge some of those gaps. And so for our audience and those in the innovation space, the startups, I mean, this is a very rich conversation about need and opportunity. So definitely, I think it's an important area to listen to and hopefully help solve for in the future. What from your perspective, again, you've been working in this space for quite a while, working with the little patients. What advice would you give to the people that are considering going into pediatrics and potentially considering a career in children's healthcare?
Yeah. I think I would say you should have an eye towards behavioral health, because like I said, pediatrics is a preventative specialty, and a lot of these things are things that are modifiable by working on behavior. But you need to look at behavior of adults as well as children. If the parent isn't going to make the change or help the child make the change, you're often going to hit a wall unless you have a very motivated older child who is pretty independent. And then I also think that having a little bit of a background in digital health, because that is such a prevalent thing nowadays, you got to know how to use the tools to your advantage. And lastly, I think just keeping your mind open into, I think in healthcare, there's a lot of opportunities. Even if you're mostly practicing in clinical medicine, you need to branch out to like people management, systems, knowledge, all that kind of things, since you're working in the whole system, not just that individual clinic.
Yeah, it is a holistic approach and need. And I think that, I love that notion of there's such a huge opportunity in the pediatric space to lay the healthy foundations around, well care and preventive care that hopefully can be pulled through it, as people mature and become adults, because as we know, we have that sick care model, and so much of it is behaviorally based, and we just don't do enough as a society and as a healthcare ecosystem to address those things, whether it's in the child, the pediatric population, or adolescent, adulthood, and senior. It's a huge area of need, and that goes into thinking about social determinants of health and all these other areas that sit outside the traditional sort of clinical perspective. So I think that what you've shared is a wonderful perspective that can support not only the pediatric patient, but the broader, more general population down the road, and even today, quite frankly. So thank you so much for sharing your perspective. And again, I love that notion of really focusing on the preventive side and the opportunity that you have with the younger children. So thank you so much for all the work you do, and hope to have you back and talking again with us sometime very soon.
Thank you so much.